Another question that I hear asked sometime is, are there conditions that aren't good for dry needling? Actually, there are very few conditions that aren't appropriate for dry needling. Most of these are classified in 3 categories. The first is if someone has a profound fear of needles, needle phobia. We're not going to needle somebody who has extreme anxiousness about needles. The second area of concern would be an individual has some high risk, very high risk of infection or active infection in which they're currently seeking aggressive treatment for. A third condition that we may want to consider getting some input from an individual's primary care provider before doing dry needling would be those with severe bleeding disorders. Simple communication with the primary care provider would help us steer the direction the right way to avoid any unintended problems. And ladies, women who are pregnant, dry needling can be very effective, but we're going to make sure and check with your OBGYN or your nurse midwife before going ahead with treatments so that everybody's on the same page regarding the safety and effectiveness of dry needling. So we're delighted to be able to offer dry needling in combination with the other things we do here with the Doctors of Physical Therapy at Physical Achievement Center. And there's very few conditions that we can't treat effectively with it, but there are some considerations. Fortunately, the Doctors of Physical Therapy here at PAC can help determine what's best for you and your condition.